So hello, my name is Michael Holtzhausen and I am your student nurse for this cranial nerve assessment. So first is to review the previous medical records and doctor's order sheet if available to verify the order. Next is to determine the scope of assessment needed. Prepare for the necessary equipment to ensure the organization and increase efficiency in performing the assessment. Then we must perform hand washing to deter the spread of microorganisms. So hello po ma'am, my name is Michael Holtzhausen and I am your student nurse for this cranial nerve assessment. So may I ask what is your name?
I'm Diane Eliza de Villares.
Okay, what is your birthday?
September 17, 1995.
Okay, let me check right here. Okay, then Eliza de Villares, 17. Okay. What do you want me to call you ma'am?
Diane.
So we're going to do the cranial nerve examination. It provides information regarding the transmission of motor and sensory messages. So primarily the head and neck. So do you have any questions before we begin?
No.
Okay, so as you can see, I've closed the door and the curtains to provide your privacy, and everything that we gain knowledge of will remain of its confidentiality. So what we're going to do is safe and free from distraction, so be really comfortable. Okay, so first is to assess the CN1 or the olfactory, which is the function of smell. So ma'am, I need you to close your eyes and cover a nostril and guess the smell of it. Okay. Guess what's smell?
Coffee.
Okay. Can you cover the other nostril, please? Okay, can you guess what this is?
Vanilla. Perfume.
Okay. Okay, now. So the patient is able to smell and there are no signs of anosmia. So next is the CN2, which is the optic to assess. It is to assess the vision and visual acuity. So ma'am, I need you to cover one eye and read aloud the print.
G 5 8 7 4 2 8 4 3.
Okay. So the patient is able to read it aloud. So for the visual field, can you look directly into my eyes and tell me if you can see my hands at your peripheral vision?
Yes.
Okay, the patient is able to see my hands at a normal angle at the field of visions. Okay, for the CN3, 4, and 5, which is the oculomotor, brachial, and abducens. To examine this, we examine the pupil size, shape, and equity. So for the oculomotor, it is the movement of eye muscles and upper eyelid. Ma'am, can you look directly into my eyes? And okay. Okay, the eyelids are symmetrical and the eyelids does not obscure the vision. The pupils are round and are equal in size. Okay. Now, ma'am, I'm going to shine a light to your eyes with my pen light. Okay, they constrict to direct illumination and it is a direct response. In the opposite eye, it also constricts, meaning it is a consensual response. Okay, now ma'am, can you look at my finger? Okay, now can you look at the wall? Now back at the finger. Now back to the wall. Okay? So next is to check for the extraocular movements in the 6 cardinal directions of gaze. So ma'am, can you look at my finger? Look and follow my finger. Okay. So there are no signs of strabismus nor nystagmus. Okay, so next is the CN5, which is the trigeminal. The trigeminal's main function is the sensory to face and teeth. So movements of muscles for mastication. So the mandibular, maxillary, and ophthalmic should be tested symmetrically for pain, light touch, and temperature. So, ma'am, can you clench as I palpate? Yes. Okay, you cannot clench. Okay. Okay, now so for the pain, I'll use a Q-tip. A Q-tip with a Q-tip sharp and dull end. So you will just tell me if it's soft or dull as you close your eyes. So can you close your eyes, please? Is it soft or dull?
Dull. Soft. 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 Dull.
Okay, so is this the same as this?
No.
Or is this the same as this?
Yes.
Is this the same as this?
Yes.
Okay, for next is to test for light touch. I will use a wisp of cotton in scattered areas and comparing both sides. So, ma'am, can you please close your eyes? So, can you feel this cotton?
Yes. Yes. Yes.
Okay, so is this the same as this?
Yes.
And this? Same as this?
No.
And this? Same as this?
Yes.
Okay, you may now open your eyes. Okay, so to check, next is to check for the corneal reflex. So, so ma'am, can you please look away from me? Okay. Okay, it is normal because the patient can blink and tear. Okay, for the CN7, which is the facial nerve, it innervates all muscles of facial movement and expressions. So, ma'am, I'll ask you to perform facial expressions now. So, first is to raise your eyebrows. Okay, now frown. Okay, now close your eyes tightly. Okay, next is to show me your teeth. Smile. Okay, now puff your cheeks out. Okay, thank you. So, the patient can do these maneuvers easily and symmetrically. Okay, for the CN8, which is the acoustic, a specific function is hearing. To assess for hearing, we need to test one ear at a time and occlude the other ear with a finger. So ma'am, can you just repeat what I've just said? 99
99.
baseball,
Baseball.
99
99.
baseball.
Baseball.
So next is to assess for lateralization, which is performing the Weber's test. So I'll use a tuning fork. Assuming this is a tuning fork, sit on top of the patient's head. Okay, can you hear it well?
Yes.
Okay, is the sound larger in one ear or is same in both ears?
Both ears.
Okay. Okay, so next is to perform the Reynolds test. It is to compare air and bone conduction. Can you hear this? Okay, just tell me if you can't hear it anymore.
I can't hear it anymore.
Okay, so how about now?
Yes, I can hear it.
Can you hear this?
Yes. I can hear it anymore.
How about now?
Yes, I can hear it.
Okay, so next is for the CN9 and 10, which is the glossopharyngeal and valgus nerves. It mediates the sensory and motor functions of the palate, pharynx, and the larynx. So ma'am, can you please say ah?
Ah.
Okay, can you widen it? Okay. So next is the gag reflex. One side at a time. I'm going to poke. So ma'am, I'm going to poke at the back of the throat. So can you sorry. See a rise in the palate and there are signs of gagging. Okay, next is for the CN11. It is the spinal accessory nerve. It innervates the sternomastoid and the upper trapezius muscles. So ma'am, can you show me your shoulders upward against your heads? Okay, now turn your head against my head. Okay. Okay, so lastly, it is the CN12, which is the hypoglossal. So it mediates motor functions of the tongue and affecting articulation of words. So, ma'am, I'll ask you to open your mouth. Okay. So there absence of atrophy and fasciculations. So which is normal? So can you stick your tongue out? Okay. Okay. The tongue protrudes straight out. Okay. So ma'am, that was all for this assessment. There were no abnormalities found, so it was a very good assessment. So do you have any questions before we end?
No.
Okay, so thank you very much, ma'am, and have a good day po.